It is the fastest growing health threat in this country. Kills more than breast cancer and prostate cancer combined. 2 out of 3 people who get this disease are women. What is it? Alzheimer's disease. And as I learned out, a possible cure could be found in our own backyard.
It's just important to talk about it.
Katie Prince says there were signs something was wrong with her mom, but 13 years ago, no one in the family thought it was Alzheimer's disease.
But I think because we didn't know what to look for, we just thought of it as she's getting older.
Mother's Day was the 3-year anniversary of her mom, Pam's, death. She was 67.
When my mom was on her deathbed, she still was rubbing my back just like she did when I was a little girl. So she might not be able to use her voice like she used to. She might not be able to do the things that she once could, but there's still that mom inside of her.
Her hobbies was her family.
Matt Goodrich knows Katie's pain. His grandmother had dementia and passed away 3 months ago. His grandfather had Alzheimer's. He cared for them both in the final years of their lives.
I really feel like you lose a person twice. You lose them first to the disease, and second when they pass away.
From her lab at the Scripps Research Institute in Jupiter, Dr. Corinne Lasmezas is trying to find a cure. Of the 5 million people in the U.S. who have Alzheimer's, 2/3 are women. It's still a mystery why more women get the disease. Dr. Lasmezas says living longer is one reason. Hormonal changes might be another.
Given what we're doing in my laboratory and what other people are doing in the scientific community, I think drugs that slow down the disease process could be in clinical trials for patients in about 3 to 5 years.
A family history of Alzheimer's, type 2 diabetes, and of course, just getting older are all risk factors for Alzheimer's.
Right now, what we can do is reduce our risks, and for that, there is still no magic pill.
Here are some ways to decrease your risk, according to the Alzheimer's Association. Break a sweat. Whether you're a gym owner and trainer like Matt or just like to walk, exercise will help keep your weight, blood pressure, and cholesterol in check. Fuel up right. The Mediterranean diet is recommended. Catch some Z's. Make sleep a priority. Hit the books. Keep learning, and you will increase your cognitive reserves. Buddy up. Social interaction of any kind is vitally important as we age.
I think it's more important to have the right life balance, eat right, have physical exercise and mental exercise, and as a whole you will diminish your risk factor for Alzheimer's disease.
What scientists need most of all is money to continue their research, and they're doing such amazing things up at Scripps. There have been great advances in the field of Alzheimer's disease in the past 10 years. And as Dr. Lasmezas told me, drugs that can stop the progression and indeed prevent this are in the near future, as she said, 3 to 5 years. Before then, they get to the clinical trial phase. And by the way, this research will benefit all neurodegenerative diseases. So Alzheimer's, certainly dementia, as well as Parkinson's disease and ALS. I was so impressed, Shannon, with what they're doing up at Scripps. This is a very exciting time, and hopefully it comes sooner rather than later.
Incredible breakthroughs really needed happening right here. Great story, Kelly. Right.